Hi everybody, my name is Sadia and I'm a business psychologist for ToHealth. Welcome to this free webinar run by ToHealth, who is an occupational health services provider, including customised wellbeing solutions and the awareness session that you're ending today. We also provide workplace needs assessments along with other solutions that can be tailored to your specific needs. So we'll be looking at neurodiversity and mental health, what the link is. It is a very short webinar and it aims to provide a quick whistle-stop tour and an overview of neurodiverse conditions as well as mental health. So let's get started. So when we talk about this term neurodiversity, it is a term coined by Judy Singer, who is an autistic sociologist herself. It's an umbrella term which features a number of learning and developmental difficulties. So Judy Singer's definition of neurodiversity has evolved over time, but her most recent definition can be found in her 2019 book, Neurodiversity, The Birth of an Idea. This is where she defines neurodiversity as the concept that neurological differences such as autism, ADHD, dyslexia, and others are a result of a normal, natural variation in the human genome. She emphasizes that neurodiversity is not just about recognizing and accepting individual differences, but it's also about promoting societal inclusion and accommodating the needs of neurodivergent people in all areas of life. So it's all about seeing neurodiversity as a positive reference and a valuable aspect of human diversity that can enhance innovation, creativity, and problem solving in all areas of life. Some of the words that you might hear include neurodiverse, neurodivergent. We have SPLD, so this is specific learning differences or special educational needs and disabilities. So these are the terms that are used in education. You may hear neurodifference, neurodevelopmental, or even neurotypical. So that's anybody without any neurodivergent conditions. Now, the idea is that this term neurodiversity seeks to embrace difference, but it also recognises that some people who are neurodivergent will need extra support. And it's important to understand that these are lifelong conditions. They cannot be cured, but they can be successfully managed. 1 in 7 people have a neurodivergent condition. So shown here are some of the key conditions that fall under neurodiversity. So we have dyslexia, DCD, developmental coordination disorder, or dyspraxia. We have Dyscalculia, ADHD, autistic spectrum conditions, or autism. And it's important to understand that these conditions are a different way of processing information. There are other conditions that come under neurodiversity, but we will just briefly look at these conditions that I've mentioned here. So another condition that comes under neurodiversity is Tourette's syndrome, and OCD, so obsessive compulsive disorder. So that is dependent on what literature you read, because it doesn't always come under that term, neurodiversity. It's important to note that people who are neurodiverse can be found across the spectrum of intellectual ability, and these are spectrum conditions, so people may have these conditions mildly, moderately, or quite severely. And their conditions on their day-to-day life can vary from person to person. They can also co-occur, so that means that they can occur at the same time as each other. So somebody might have dyslexia as well as ADHD. So if we take a look at what mental health is now, so when we talk about mental health, this refers to a person's overall psychological well-being, including their emotional, psychological, and social functioning. It is an important part of overall health and involves factors such as the ability to cope with life's challenges, maintain positive, good relationships, and make healthy decisions. Good mental health allows individuals to realise their full potential, work productively, and contribute to their communities. And conversely, poor mental health can affect a person's ability to function, leading to various mental health conditions such as depression, anxiety, and bipolar disorder. So mental health can be impacted by a combination of genetic, environmental, and lifestyle factors, and it is essential to take care of mental health as well as physical health. So in terms of what the link is and the differences between these conditions, it is important to understand that neurodivergent conditions and mental health conditions, they are related, but they are also distinct concepts. They are not the same. So when we talk about neurodivergent conditions, this refers to differences in the way the brain works, which can result in differences in behaviour, cognition, sensory processing, and conditions can include things like autism, ADHD, dyslexia, as well as the ones that I've mentioned. And these conditions are often characterized by atypical patterns of sensory processing, social communication difficulties, as well as repetitive behaviors or interests. Mental health conditions, on the other hand, refer to the disorders that affect mood, thought patterns, and behavior, and they're typically diagnosed by mental health professionals. Conditions include depression, anxiety disorders, bipolar disorder, schizophrenia, post-traumatic stress disorder, amongst others. And there can be some overlap between neurodivergent conditions and mental health conditions. They are not the same. So some neurodivergent conditions such as ADHD can co-occur with mental health conditions as well, whilst others such as dyslexia, for example, it does not typically involve any mental health conditions such as so similarly, we might have some mental health conditions such as PTSD, and this may result in changes in brain function or processing, but are not necessarily considered neurodivergent conditions. So let's take a little bit, look more briefly at some, but not all, of the neurodivergent conditions. So we have autism. This can include challenges with social interaction, sensory overload, and communication difficulties. Some workplace adjustments may include things like providing a structured and predictable work environment, minimizing sensory distractions, providing clear and visual communication and instructions. It can also involve allowing a quiet or private workspaces for your employees or colleagues, as well as providing social breaks to recharge and offer opportunities for skill building and training. Dyslexia. So individuals with dyslexia may struggle with reading, writing, spelling, and phonological processing. So that's the sound of words. And workplace adjustments can include providing written instructions in a clear font, for instance. So anything that's 12 plus is described as a dyslexic friendly font. So maybe something like Calibri 12 or plus or 13. So Calibri 13 or Times New Roman. You can also, by providing extra time for reading and writing tasks, offer assistive technology. So there is speech to text and text to speech software for people that can assist in these tasks. You can provide training and mentoring opportunities and offer accommodations for testing and certification exams. So think about the format of the exam. Dyspraxia. So this can, somebody with dyspraxia may experience challenges with motor coordination, planning, and organisational skills. Some of the things that you can do to assist people with dyspraxia is to ensure that written instructions are clear and concise, Allow extra time for tasks that do involve fine motor skills, so anything that involves writing or using your smaller muscle groups. Provide assistive tools and equipment, minimize distractions, offer a flexible working schedule, and again, also provide opportunities for training and development. Dyscalculia, so this impacts a person's ability to manipulate numbers, understand maths concepts, and it can include difficulties with timekeeping and understanding money. Some workplace adjustments can include things like providing speaking calculators, digital measuring tools. Think about how you represent your data. Any numerical data can be presented visually, so in terms of pie charts or bar graphs. Think about how you give your instructions. Are they clear, concise, or are they overly numerical? And think about providing extra time and training. So these are the kind of things that people can do to provide additional support to their colleagues with dyscalculia to help them develop strategies to manage their difficulties, as well as build their confidence in their abilities. So in terms of the strengths that neurodiverse individuals have, so there's lots of strengths here, but they are not exhaustive. There could be more as well. And often the focus is on areas of difficulty, but it is important to understand that neurodiverse individuals can have many strengths too. And that is what research has shown. So some of the skills that we have listed here, research has shown that neurodivergent individuals can often possess these unique skills and talents. And people with it can bring a fresh perspective to work. They may approach problems and challenges in different ways. And this can lead to new solutions and innovations for the business. So, for example, somebody with ADHD may be particularly adept at multitasking and quickly shifting their focus between different tasks. And this can be really a fast-paced environment. The idea is that by embracing neurodiversity, we can create a more inclusive work environment that supports the unique needs of neurodivergent workers, and this can lead to increased satisfaction and improved productivity, making everybody happier. So in terms of statistics, here are some statistics. So approximately 70% of autistic adults in the UK have a mental health problem such as anxiety, depression, and obsessive compulsive disorder. Adults with ADHD in the UK, they are at a higher risk of developing mental health problems such as depression, anxiety, and substance abuse. And we know that dyslexia is associated with increased rates of mental health problems such as anxiety, depression, and that's according to the British Dyslexia Association. Dyspraxia, so this is associated with an increased risk of mental health problems, including anxiety and depression. So when we talk about neurodiversity, this refers to a natural variation in cognitive functioning, which includes differences in attention, perception, learning, and social interaction. Neurodivergent conditions can impact mental health and well-being and can often result in mental health challenges such as anxiety, depression, and social interaction. And neurodivergent condition mental health is through social interaction, and individuals may struggle to understand and navigate social situations, which can lead to feelings of anxiety and social isolation. So know that difficulties with sensory stimuli can also contribute to mental health challenges. So many individuals with neurodivergent conditions may have a heightened sensory sensitivity. So this could be sensitivities to light, textures, smells, And this can cause them to experience intense reactions to stimuli that others may find quite tolerable. It can be particularly challenging in environments that are overstimulating, so such as busy public spaces or workplaces. The resulting stress of this and anxiety can lead to mental health problems such as panic attacks, anxiety disorders, and depression. So when we talk about executive function, so this refers to cognitive processes that enable us to plan, prioritize, organize, and complete tasks that many individuals with neurodivergent conditions may struggle with. This can often lead to feelings of overwhelm and stress, and even anxiety, depression, as well as burnout. So it is important to recognise this overlap between neurodiversity and mental health and to provide appropriate support and accommodations for individuals with neurodivergent conditions. This can include things like therapy, counselling, medication, sensory accommodations, and support in navigating social situations. And with the right support, individuals with neurodivergent conditions or mental health conditions can thrive and lead fulfilling lives. So how can we try to create a culture of inclusion? So this can include things like taking a look at your recruitment, training, and mentorship programs. Think about ensuring that your recruitment strategies and training, that they are accessible to those with mental health conditions or with neurodivergent conditions. Think about implementing these strategies that can support success and the well-being of employees as well, all those with neurodivergent conditions or with mental health conditions. Think about your communications. Encourage open communication between employees and their supervisors to discuss any accommodations or support as needed. Think about providing education to all of your employees on neurodiversity and mental health conditions. And this enables you to create a more accepting and understanding workplace culture. You can also offer resource groups or support groups, so people within your organisation are able to connect with each other to share their experiences. So these are some of the quotes that I've taken from people that I've assessed, and they are very typical of the comments we hear. So people might be quite worried about disclosing their condition to their employer because they are worried about these kind of things here. They may be worried about their career progression. They may be quite embarrassed about their condition as well. They don't want to be seen to be making a fuss. They may feel that people may not believe them, or even fear that they might be coming across as dishonest because why did they not reveal their condition sooner, or let the employer know sooner, sorry. So it is important to try to understand some of the challenges that people might face when disclosing their condition. So the Equality Act 2010, so this exists to protect people from, so anybody that does have an impairment or any substantial long-term any condition that has a long-term adverse effect on a person's ability to carry out their normal day-to-day job. So this looks to protect those that may come under this act. And you may think, well, you might need to be diagnosed to be able to be covered under this act. But this act also covers those with neurodivergent conditions as well as mental health conditions. And it protects people from discrimination in a range of areas, including employment, as well as education and the provision of goods and services. Employers are required to make reasonable adjustments to ensure that people with neurodivergent or mental health conditions can access services or employment on an equal basis with others. So some of the support offered by ToHealth includes awareness training, which supports more people to understand the neurodivergent condition or the mental health condition. Encourage disclosure for those who are diagnosed and those who are not diagnosed. It is about trying to get the conversation going around neurodiversity and let them know what help there is. So some of the support that we do offer are coaching and co-coaching services, screening and diagnostic assessments, assistive technology training. So we also provide things like speech to text and text to speech software, as well as the training required to be able to use these effectively. And we can tailor-make packages for individuals that do require this support. The idea is that if an employee is happy at work, they are less likely to take any absences and they are more likely to work as productively as possible. So this is a win-win situation for both the employee and the employer. So change is on the horizon, and more organisations have embarked on a journey towards inclusivity by promoting diversity within their workplaces. Indeed, over the past decade, there has been a significant increase in the celebration of neurodiversity. So notably, influential figures such as Richard Branson, Steve Jobs, they have spoken about it, highlighting its importance. That's because they have neurodivergent conditions as well. And while not all of us aspire to be the next great business leaders, their efforts have helped to build awareness, understanding, and acceptance of neurodivergent conditions. So to wrap up, here is a quick summary of what has been discussed. It is and acknowledge the intersections as well as distinctions between neurodivergent conditions and mental health conditions, and each requires unique forms of support and accommodations. Individuals with neurodivergent or mental health conditions may experience stigmatization or discrimination, making it crucial to provide understanding, to support and promote their well-being and success. And this is where fostering an inclusive environment is very, very important indeed. So I'd like this opportunity for you to reflect on what you can do and how you can try and do things differently to ensure that everybody, your colleagues, for instance, are feeling as part, just like they belong even more than they did before, perhaps. So what will you do to ensure that you support your neurodivergent employees or colleagues? Value your feedback. In fact, I will talk about getting in touch with us. So if you would like to get in touch, you can email us, use our website, use our social media pages, and we do value feedback as well. So I will finish on this slide here. Do feel free to click on the link or take a photo of the QR code to leave some feedback. And we will be running more of these workshops in the future, so do look out for those. Thank you everyone for joining.